Good Saturday morning, everyone. Today on Perspectives, many of us were shocked just a few weeks ago when learning that a healthy three-time Olympian, a world champion elite athlete, had died while in labor. She was 8 months pregnant and in labor at home. The death of 32-year-old Tori Bowie has drawn renewed attention to what many are calling the maternal mortality crisis in the United States. Tori Bowie was once the fastest woman in the world. And according to Tori's autopsy, she died due to complications of childbirth. She was found dead in her home in early May. Her manner of death, the report said, was natural. Now, the medical examiner stated that Tori faced possible complications. Other reports noted that she had a well-developed fetus in her uterus. Her baby, a daughter, did not survive. According to health officials, this is something that we saw more frequently in the old days, but it has not disappeared. It can still occur today. And it's believed by many that inadequate prenatal care is a major cause. And what's more alarming is how often deaths like Bowie's are happening. A CDC report released in March of 2023 shows a significant increase in maternal deaths from 2020 to 2021 for all races. But the maternal death rate for black women is 2.6 times more than for white women. And according to some health advocates, a conversation has been going on now for about the past 2 to 5 years because women have been dying at a very high rate, especially black women. Our guests this morning on Perspectives are here to give us a better understanding of maternal mortality, especially in Alabama. Mobile County's health officer, Dr. Kevin Michaels, with the, of course, Mobile County Health Department. And Dr. Amber Clark-Brown. She is the medical director for health equity with the Alabama Department of Public Health. When Perspectives continues this morning, we'll learn more about maternal mortality and what causes it and why it's so high in the United States, and what health officials are saying can be done to reduce the risk. We'll be right back after this quick break. And welcome back this morning. We're talking about maternal mortality, a very serious issue that is of concern for a lot of people in our state as well as around the nation today. Joining us today again, Dr. Kevin Michaels and Dr. Amber Clark-Brown. We thank you both for being a part of this discussion. Thank you. Let's start out first because it was a shock to a lot of people that it's happened to a woman who was a elite athlete and the type of health you would expect. But I remember hearing that her weight was very low. When you think about a woman in her 30s, she was weighing less than 100 pounds at the time of her death. Let's talk about what first is this problem that we're having in the country now, because the numbers are going up. And I guess let's talk a little bit about that as well as what the numbers are, because the numbers, when you look at it as a figure, you say, well, that's not a lot of people in a population the size of this country. But compared to what has been going on and what we expect in this nation from a health perspective is the issue. First, give us an idea of what we're talking about. What exactly is this?
So with maternal mortality, again, we're looking at the rate of maternal deaths associated with women within they're pregnant or within the year that they have given birth. And particularly, again, if you've already noted, we've seen an increase really within the last 3 years within the country. And I will say this is not something that is unique. It has been going on, but to your point, it's really just gotten a lot of national attention. When we think about, maternal mortality, it is alarming. And we know that there are disparities even within the population, more notably within African American women and mothers giving birth. We see that their maternal mortality rates are higher. We can talk about the morbidity, which does lead to mortality. We can talk about that later within this interview, but it is alarming, particularly in Alabama. We are higher than the national average. Actually, in 21, we were in the top 3, states that had the largest mortality rate. So this is very, very, very alarming, and we are definitely looking into this matter. The state has convened a maternal mortality review committee to really look and see, hey, what is going on within the state? I'll pass it off.
Yeah, I mentioned to Dr. Michaels bringing the Mobile and Southwest Alabama sort of in the picture, because one of the things that you've seen, the health department here in the county saw a need back in the late 90s to create a position to sort of address this.
So we have a fetal infant maternity review committee, and so this community comes from providers and healthcare workers across the county. They come together and they review the cases, or review those situations where there was an unexpected outcome, a death of a child, a death of a mother, and they look at it, and they're not large numbers because, you know, kind of going on the maternal mortality rate is really 100,000 births, and looking at the deaths in that group over that period of time. So there's got to be a lot of births from that. And so we'll look at it, and we're looking at the risk factors to see what things we can do that are preventable.
Yes, yes.
Because 4/5 of the deaths associated with maternity are preventable.
Now, Tori was 32 years old, but in our conversations earlier, you were telling me that what we've seen in our area and in the state too are younger women who this is happening to, and that's, you believe, is some of the situation that's creating the problem is the age maybe of them.
Well, you know, again, the age, and then also access to health care, because there may be chronic health problems that either may not have been diagnosed or were not being addressed. High blood pressure, high blood sugar, or diabetes, those may be risk factors. There may be a component of substance use. And again, those are all things that complicate what people would see as a completely natural process of pregnancy.
And when you look at that information, what seems to be the problem with the prenatal care when we talk about looking at that? Because we do know that we've lost a lot of rural hospitals, but is it just happening to women in the rural area?
It's not. It's really all over. And you know, we talk about prenatal care, but there's even kind of the preconception care. Just going back to Dr. Michael's point, the reality of the situation is a lot of moms that are getting pregnant aren't as healthy as they used to be, again, because we have all of these chronic underlying issues. We see this within the southeastern, you know, portion of the United States, again, hypertension, diabetes, and there is a place for that, and there really is importance. You know, we talk about planning pregnancies as well, because if you know that you have chronic illnesses, you can really work to get those in as best shape as you can before getting pregnant, because that will help mitigate, you know, complications. Listen, childbirth, bearing children is one of the most beautiful things women can do. Honestly, it's also one of the most dangerous things that women can do. So anything that you can do to mitigate that, I think, is really helpful. It does also, again, go back to access. You know, we are losing maternal, I will say, resources in rural populations, but it's not everywhere because it's hard for, honestly, hospitals to staff them. You know, how do we get obstetricians here? How do we get people that really care, you know, and are really passionate about mothers and their babies, and giving, you know, supreme care to them, because that's a very vulnerable, you know, time.
And so when you look at this, is income also a part of
so the big thing, one of the things that we offer throughout the state and many of the health departments as the proponent of it is a woman and infant child program, WIC. And so WIC services allow mothers who make sure that they have adequate nutrition during their pregnancy, and then allows for them to have adequate nutrition post-pregnancy during a critical time of that developing, you know, that developing child, to make sure they're fed and set them off to a good start. So based on, you know, their income and their nutritional status, there are, you know, they're supplemented, you know, for formula post-pregnancy and also for food, you know, during pregnancy, to ensure that they're setting themselves up for the right. To have a healthy outcome for their child. Sort
of getting that playing field up to par, so you got a good beginning. When we've got about a minute so left, so we'll stay on something before we go into the break. But when you look at those two factors, then when you talk about the condition of having available facilities for prenatal care, a mother's income, I guess Alabama, of course, would be one of the top states.
It would. It would. And along those points, kind of piggybacking after Dr. Michaels, the state health department has started All Babies. So it provides, we're only in 36 counties right now. The goal is to extend it out to, the 65 counties that we service. But it gives moms, pregnant moms, access to care. And it's a partnership through Blue Cross Blue Shield of Alabama, through their PPO providers. So it's during pregnancy and after pregnancy as well. And their applications, they can go online, ADPH, to find
We'll make sure we get a lot of that information out at the tail end of the program, so we can have advice for where beginning moms or where they can go. Our very special guest this morning, Dr. Kevin Michaels, and of course Dr. Amber Clark Brown joining us as we're talking about maternal mortality. We'll have more on that in just a moment. We'll be right back. And maternal mortality is our subject this morning. One that's very difficult when you think about that. And of course, our very special guests, Dr. Amber Clark Brown and Dr. Kevin Michaels, as we were discussing a look at our county as well as our state. And a lot of the information, as you mentioned, Dr. Michaels, is involving the state because you're looking at a percentage of 100,000 births, which would be very difficult to have in a county in the state itself. How many things have changed in the last recent years? I understand that a law has been passed that allows a period of time to be extended much further than it was at one time.
Yes. So within the last, I guess, 6 months, they passed, whereas a mom would have, through Medicaid, they would have 90 days of care, has now been extended to 1 year, which helps then the mom kind of bridge the gap, address the health issues, and whatever the next step may be for her.
That's very good when you think about a longer period of time for the evaluation, for opportunities to ask questions.
Right.
Let's look at a couple of things when we talk about the affordability as well as availability of the prenatal care, because that's something that, we've lost some of the benefits that we used to have in the family, where you had a grandmother there, and in some cases a great-grandmother who had information, wisdom to pass down to younger mothers especially. So where do these young women go now when they get pregnant, I guess you say?
Sometimes nowhere. It depends on where they are, within the state. If they're very rural, they may have to go 1-2 counties over to receive that care. Or sometimes women just show up in labor. So there is definitely a lack of prenatal care, and we're seeing the effects of that.
Dr. Michaels, can you give us an idea of what things are like here?
Again, that's a challenge that the choice that the family or that individual makes, if they opt to live in an area because maybe that's where their family is from, that's where their job is, and it doesn't necessarily have access to the care they need. They may not have the specialties to manage their chronic health conditions, yet alone pregnancy. So that's the difficulty in that. Even within our county, we have a number of great hospitals. We have a lot of OB clinics available, but transportation, getting from one part of the county to the other, may make it difficulty getting access to care. And like Dr. Amber Clark said, people will show up in the hospital in labor, and that's the first time they're really being told they're pregnant.
Right. So how do we address that today? This is 2023,
right?
And of course, we think that we're all linked from a communication standpoint and able to reach a greater number of people than ever before, but yet we're still lacking in areas of major health concern. When we talk about someone who's had no prenatal care, no doctor's appointments, and then they are there to have a child.
Yes.
So how do we start changing this? What is happening in the health department, both on a state basis and locally, that you are part of that changing and education?
Well, I'll chime in there. Is that we have a number of outreach programs that that are sponsored through our community outreach workers that engage, educate people when they come in, and part of that is also, the education they receive in school, and at what point do they find, hey, I can become pregnant, if I participate in these types of activities.
Are they still teaching health in school?
Again, I can't speak on what the school is teaching.
Right.
But
I mean, from your awareness, are you all hearing that used to be a part of the curriculum? Back, I remember my grandmother used to be in home ec class teaching some of those things.
I can't say what the school curriculum is or isn't.
Yeah.
Young men and women should be educated. At what age? Again, it should occur in the family. The family should be participating in, and unfortunately, as you said, we've lost that as the older generation. Unfortunately, the older generation has moved on. Maybe we don't have that traditional mother, father in the household, and nothing wrong with that, but you still need that parental input on what you need to do.
Right. So much wisdom there to share in that experience, because as you said, it's joyous and beautiful, but one of the most dangerous moments as well.
And I will say, it's that wisdom, but it's also that support, and we talked about not having kind of two-parent households. There are statistics that do show that, you have more complications, especially with infant mortality, when you aren't having two parents in the household. And so that support system is critical. Within the state, I already mentioned, the All Babies program that we are more than excited about. And again, the end goal is to get that into all the 65 counties that ADPH services. I mean, women are getting dental health services through this. It's not just, checkups, for hypertension, diabetes. So it's really comprehensive, as well as their prenatal care with their OB-GYNs with that. Also providing nutrition classes as well. So we are really trying to, from what we can do as the state level, champion that. And we also want to encourage women as well, to be their own advocates. I will say, I'm no longer in clinical medicine right now, but one of the things that I championed, and I never practiced medicine this way. I didn't practice paternalistic medicine, but it was a partnership. So, women don't feel like, you're stuck. If you're with a provider that y'all aren't jiving well, you can move on. If you feel like you're not being listened to, it's okay to fire the doc, for lack of better terms.
Now, you just brought up one of the points that you hear a lot of when women are talking about some of the problems they're seeing in this, that they're not being listened to and heard by those physicians.
We also have to educate ourselves as a healthcare consumer to be a better healthcare consumer.
Yes.
I've experienced it in my healthcare that I was in a position I could do it. I fired 2 of my providers and said, hey, I'm having difficulty communicating with them. They're having difficulty communicating with me. And that leads to some of our problems, is where you say, hey, the doctor is not listening to me. And we need to understand that, hey, that doctor's there to work with you, and if you're not communicating, you can respectfully request somebody else to assume care.
You're actually hiring the doctor, right? Aren't you actually hiring the doctor? He's working for you.
Oh, yes. I thought you were asking. I'm always hiring. I'm always hiring doctors. Yes.
Right.
But exactly
that's
right.
What
exactly.
the woman is doing. The mother to be is hiring that doctor. So you expect for them to respond. Do we have the program that Dr.
The All Babies
Brown mentioned here?
No, we don't have it here, and I've talked with the health officer. Part of it is they're getting it out to those counties that are high priority.
Right.
And if you look at Mobile County compared to another county in the lower part of Alabama, we have a number of hospitals, we have a number of specialists. We have 4 FQHCs in our community.
What is that? That's
federally qualified health centers. You got Family Health, Mosteller, Franklin, and Accordia or Alta Point. So we have those services. It's not a cure-all, but some of the other counties don't have that or have very limited. So, it's a matter of time before it phases in totally within the
That
65
makes
counties,
sense.
and then the rest of the state.
Right, everybody.
So
we've got about a minute left. Tell us quickly, what do you recommend for a young lady who's listening this morning?
First of all, if you aren't pregnant already and you're planning to have children in the near future, focus on getting yourself in the healthiest condition possible. That is something that is within your control. I know a lot of times we deal with things that aren't in our control, but that is definitely something. There are a lot of free programs. You can please Google or look up ADPH. We offer a lot of services to the state. The second is also, if you don't already have an OBGYN, go ahead and establish that relationship. You have gynecological needs already before you're pregnant. So go ahead and kind of interview your doctors to see if this is someone that you will feel comfortable, working with during your pregnancy. Do your best to decrease stress as much as possible. We didn't talk
That's
about
always
that,
a
but
factor.
that is a huge, particularly in the Black population.
Never
a huge
enough time,
issue.
and I
Right.
really appreciate both of you so much today
Yes.
for being here and sharing this information. And for more information, we've got that there available for you for our Mobile County Health Department, the Downtown Health Center. There's the address and the hours, as well as the phone numbers, as well as for medical appointments, and then of course the website for general questions. Very important. We thank you again, Dr. Amber Clark-Brown
Thank
and
you.
Dr. Kevin Michaels. We thank you so much for sharing the information, and we hope that this will be a blessing to you as well. We thank you for joining us today on Perspectives, and until next time, you have a great week ahead.